More than 10 million people have been officially confirmed to have contracted COVID-19 around the world, and among them, over 500,000 have lost their lives. South Korea, meanwhile, has been widely praised for its handling of the coronavirus outbreak. Without a national lockdown, there have been less than 300 deaths related to COVID-19 here in Korea. This means that there have been far less than one death for every 100,000 people in the country. If you compare that number to the US, where there have been 38 deaths for every 100,000 people, what Korea has so far done is a quarantine success. But the fight is not over yet. To share with our international audience how South Korea has so far handled the outbreak, what unexpected quarantine and social problems we've experienced in the process, and how Korea and the rest of the world can better cope with in the second half of the year, we have prepared a special roundtable with renowned medical experts and social intellectuals. Joining us here at the KBS World Studio in Seoul are Professor Kim Oh-ran from the National Cancer Center's Department of Cancer Control and Population Health. She's in charge of the COVID-19 Committee of the Korean Society for Preventive Medicine. Sitting next to her is veteran journalist Mr. Michael Breen, former president of the Seoul Foreign Correspondents Association. He's a prominent columnist for several South Korean newspapers. Sitting across Mr. Breen is Dr. Byoung-joo, a renowned political analyst. He also worked as a special advisor to the South Korean Trade Minister. And Dr. Jerome Kim, Director General of the International Vaccine Institute, is here with us. He's a medical doctor by training and is now leading efforts to develop COVID-19 vaccine in Korea. And I'm Bum-soo, Chief Editor of KBS World English News Service, hosting this roundtable. Thank you all for coming to KBS today, and thank you for tuning in. 감사합니다. Without a further ado, I'd like to get right on to our main discussion now, and I would like to begin with you, Dr. Jerome Kim. How do you evaluate South Korea's handling of COVID-19 outbreak so far in the first half?
South Korea is being held up as an example of how democratic societies can confront, control COVID-19 infection. It's been exemplary in many regards, and the ability of the government to suppress infections to under 50 new infections locally transmitted a day is really something that many countries are going to strive to maintain as the lockdowns are eased. South Korea was prepared. It had very clear command and control and very clear communication, which some countries have had difficulty maintaining. Decisions were made quickly and were data-driven and discussed openly in public forum. And I think that the main concern that people raise is around privacy and privacy-related issues. But again, the Korean government and the Korean people came to this decision in the period between the MERS outbreak and the current COVID-19 outbreak when there was time to discuss and reflect. These decisions weren't made at the spur of the moment during the worst of the COVID-19 outbreak. So again, in a way, that is what you want to have, open discussion around the issue of privacy versus lockdown versus being able to go out to the supermarket.
So what you're suggesting is South Koreans had this tacit consensus to put up with this rigorous social distancing campaign as well as rigorous contact tracing.
And it wasn't a consensus necessarily, but there was a government decision. There was a revision of a law that had to go through a process of revision. So there was an opportunity for discussion. And so while there was consensus, there had been discussion beforehand.
Sure. Dr. Byoung-joo, how do you evaluate quarantine efforts in the first half of the year?
I guess before directly answering your question, I think a few points need to be made very clear here. Around the world, many governments would like to claim credits for their alleged success, perhaps in some of the countries where we've seen some signs of success indeed. While there are many failures around the world and where people would like to quickly point the problems to the government. But here, in Korea's case, I don't think we should go overboard in terms of assigning the credit to the government itself. This current government has been in place for the last 3 years. And what we have in place, what Dr. Jerome Kim pointed out, the system of the manage here is something that has been built over the past several decades. And in this system of democracy here, we have 10 years, every 10 years government changed from progressive to conservative. And through this turns of the governments, Korean people continue to have consensus, and based on consensus, we were able to build this kind of system in place. So government taking any particular credit for any kind of results of this is going overboard. Rather, it's the people and the system altogether. And what we have to keep in mind is, I guess I'm making similar point that Dr. Jerome Kim has already made, but altogether we have this medical system, social system in place that has been kind of like improved upon based on our previous experience with SARS and MERS on one hand. And then on the other hand, the communitarian spirit that I like to call, people acting together as a community and collective to do the proper things, to prevent and reduce the spread of the virus. And this social behavior and social norms, which is not exactly the same as the ones that we find in some of the more liberal or, the individual-centered societies around the world. So there have been differences. So before talking about superiority or success, I guess some of the differences that we have built in this society just happen to have made a difference this time. So I just want to make that point very clear there.
Mr. Brin, what's your take?
I agree with what Dr. Kim said. I think it's very his comments are very appropriate. I would give Korea a silver medal. I'd like to give the gold medal to Taiwan, and a country we don't hear much about, Mongolia. The last time I looked, they'd had almost 0 cases because they acted very, very quickly. I think, and as Dr. Kim said, just crediting the government 100% makes me feel a little bit uncomfortable, and I can see the country not used to sort of being praised in this way, and it going to everybody's head a little bit. Like we're already having conferences to teach the rest of the world what to do. There's that sort of feeling, and that makes me feel a little bit uncomfortable because the second wave hasn't come yet. But also I think credit needs to be spread around a little bit. And I think we had some luck. I don't know what the experts think of this, but it strikes me that if we were the second country, the first outbreak out of China, and I think there was no way that Korean citizenry would accept a Chinese-type lockdown. And so the government had to find a way to handle it, and it had some recent experience with MERS. And in fact, in December last year, the disease control people had a simulation, ironically, of this very sort of thing. So people were... Anyway, there's a bit of trial and error. I'll leave it there. I'm sort of rambling on a bit too long there. I'll leave it there. But I just think some credit should go to the citizenry, the government, and a bit of luck. I think the point I was going to make about being the second country was that had Europe and America got infected before us, I reckon we might have followed their type of lockdown. And I think that one thing that allowed us to sort of become a bit of a benchmark was the fact that we were the first democracy to be faced with this, and I think responded very well.
Dr. Kim-Woran, what's your opinion?
Yeah, I think there are many key points for this fighting pandemic, and among them the health authorities' early response and public participation are the main component, I think. And health authorities are using massive testing and extensive contact tracing and contact quarantine and confirmed patient isolation. And moreover, people voluntarily take part in social distancing and wearing a face mask like us. So that's a very, very important point. Yeah.
Let's now discuss other problems we witness in the government's handling of the pandemic, as well as social issues South Korea experienced amid the outbreak. Let's begin with our medical experts first. Dr. Kim Oran, do you think the South Korean government could have done better in its contact tracing and other quarantine efforts? Is there any room for improvement?
Yeah, when we think about that, in this point, we think there are some rooms. Actually, active epidemiological investigation and information disclosure have caused excessive personal privacy and human rights issues. So fortunately, many improvements are being made now. Also, a long-term preparation system to fight the pandemic should be established, including a research institute dedicated to epidemiological investigation, data analysis, and mathematical simulation study.
Dr. Jerome Kim, do you agree with Dr. Ki? And were there any loopholes or blind spots in our quarantine efforts?
Yes, so I think it's important to recognize that every epidemic is different and is driven by the characteristics of whatever virus or bacterium, germ is causing it. But the virus is relentless, and no one has a preset handbook. So governments can adapt to situations as they develop, but they're not going to be able to say, well, this worked during the flu pandemic, it's going to work again. They have to be able to look at data and make new decisions continuously. And I think you saw some of that self-correction, for instance, during the stigmatization issues around the Itaewon outbreak. The government said, okay, well, we understand, so anonymous testing. You can just give your phone number, and that increased uptake. So using the data, using concerns, and then coming up with a new plan. I think you have to be flexible. You have to be able to respond quickly. And I guess I think sharing what you've learned is very important, because there are a lot of places that still have a lot of lessons to learn, and as they adapt to their new outbreaks and their new normal.
Dr. Kim Byoung-joo, it seems to me that the government's rigorous contact tracing and social distancing campaigns sort of expose social problems that perhaps were waiting to happen here in Korea. Would you agree with that description? And if so, what underlying social problems did the pandemic bring to the surface in South Korea, do you think?
Not as much about the government, but rather some of the politicians, their reaction to the religious sect, for instance, at the beginning of this phenomena here in Korea when it broke out first time. Some of the what the critics would call the populist, politicians with populist tendencies rashed out, and they were very critical about this religious sect, and so that concerned me a lot at the beginning. But somehow, I guess the overall public opinion successfully managed it in a kind of a, could I call it a mature way? I guess it's a subjective term here, but a more calm and mature way eventually. And after that, as Dr. Jerome Kim has already mentioned, but Itaewon case, when that broke out, also I was concerned once again about how the society will react to the LGBTQ issues here. And initially there were some signs of concern indeed. And there were angry voices in social media, for instance, against this social minority. But at the end, again, I think we reasonably successfully handled that question altogether. What disappointed me was later on, when the Ministry of Justice, not Ministry of Health, but Ministry of Justice acted to require re-entry permit for long-time residents, foreign residents, immigrants here in Korea to apply for re-entry permit when they leave the country. That I thought was very outrageous in my own mind. Because having lived in the United States as a permanent resident for years, several decades ago, I know how it feels when you have your family, your base is a foundation of living in this country, but the government of this country says, well, your coming back to this country is conditional, and we'll make that decision for you. That's really, really outrageous. And I thought Ministry of Justice taking that action as a kind of knee-jerk reaction for so-called control of the phenomena here, I thought that was very irresponsible. So that's one major disappointment, while I was pretty satisfied and pleased with the way society handled the religious sect eventually and the LGBTQ issue eventually as well.
So stigmatizing minorities in our society, some discrimination war issues you witnessed, Mr. Breen, what's your take?
Yeah, I think one explanation for the stigmatization of, say, sexual minorities is that from a European American point of view, when we hear, that we have a progressive government in power and we have conservative opposition, you would expect the progressives to sort of be similar to liberals in America, but they're not. I mean, Korean political progressives are social conservatives. So being gay in this country, let alone being even more minority, is not a very comfortable. It's still not a very comfortable experience yet. So, but I thought, as Dr. Kim said, I thought that was handled pretty well. And in fact, I think the health authorities, someone in government actually came out and asked the media to, tone it down. The one media in particular, which is owned by one of the Christian churches, was quite vigorous in its criticism of, when the cluster rose around the gay clubs, and they were asked to sort of tone it down. I think the privacy issue, coming back to that, is interesting because the common wisdom about Korea is that it's a very fractious country and people don't trust the government and things like that. But actually, when Korea is under threat in this way, there's a level of unity that goes much deeper, and the people rally around. And I think the key, the transparency engendered trust, and then that was why the sacrifice of privacy temporarily, nobody complains about it. There may be on the edges, there may be in some unfortunate things. I think some members of the religious sect where there was an infection at the beginning were sort of identified and were harassed by journalists and so on. But I think that has calmed down a bit. Two other quick things I find interesting is, one is, unlike other countries, the prospect of quarantining, there was no panic buying here. And I think that's down to a very highly developed e-commerce and home delivery sector. So even if we had the entire country been locked down, we would have still been getting our sort of breakfast in the morning, so to speak, delivered. You order at 11 o'clock at night and it's there at 6 in the morning. So this is a fantastic system, and they've really, some people are even calling these companies involved as sort of the heroes of this pandemic. One other quick thing is, I think will be interesting, and you may want to talk about this in a minute, I don't know, going forward, is that the virtual learning has sort of raised some issues, one of which is a lot of university professors, no offense to our professors here, but a lot of university professors are not being very well evaluated in how they handled is teaching, and students are demanding their fees back. So this is a bit of an issue, and it'll be interesting. I think the longer that this pandemic goes on, and if we do get another in the winter, if it sort of comes back, the longer this virtual learning goes on, the more I think we're going to see the education system having to adjust in some way.
Sure. As we are now entering into the second half of 2020, what kind of solutions would you suggest to resolve the social problems that we discussed? I would like to begin with Dr. Jerome Kim. You were busy writing something.
Yeah, and so I think, until there's a permanent solution, a vaccine with sufficient vaccination of the population, I think we're going to have to get used to this low level of outbreaks, and hopefully the government will be able to contain the outbreaks. But that has to continue with very strong messaging around prevention. And the government has a very fine line to walk, I think, because on the one hand, you don't want them crying wolf. When the number of cases is 30, averaging 30 a day, new domestically spread cases is 30 a day, it's hard to get people worried on the one hand. On the other hand, if they keep overemphasizing this, then people will say, they're just, it's just the government, and they'll start ignoring things. So it's a very fine balance to keep people aware and nervous enough to ensure that there's good compliance, because I think these outbreaks are essentially lapses of good judgment. around using masks, about these bars and clubs and all the different venues that Koreans gather in high-density settings, which I think is probably a little more common here than in other societies where there's more space and less social activity that is group related.
Dr. Kim Byoung-joo, what kind of solutions would you suggest to resolve the social problems that we witnessed in the first half of this year?
I think social problems, first of all, because I in my own personal judgment, I think we have handled some of the minority issues pretty well. I think we don't have as much challenge, but again, the government reaction to another social minority, which I mentioned, the foreigners, for instance, right? That kind of knee-jerk reaction that we've seen by Ministry of Justice should not be repeated. And there has to be a lesson learned from that. I know that particular decision by the Ministry of Justice faced much of opposition, and they scaled down big time. So a lot of my foreign friends here say it has become almost meaningless, but still it kind of affects some of the long-time residents, foreigners here in Korea. And I really hope that does not happen again. That's one major point. And another point that I have in mind is the tracing in particular reference to privacy. So far, I think Korea has handled it pretty okay, but when we have the second surge, third surge, are we still going to rely on this kind of a tracing method? And are we going to follow everybody in terms of where they've been to and all that kind of details? Or are we going to treat this case as some kind of, as Dr. Jerome Kim mentioned, some kind of a serious flu or whatever, and then just to focus on treating the patients and then limiting the spread rather than tracking down every single individual cases and try to find out, where this all came from, whether that's technically possible or not. I have a lot of doubts, not as an expert. I'm a non-expert, but so those kind of lesson learning, how society quickly learns from this kind of experience over time in a very speedy manner, I think that will probably determine the question of whether we're going to succeed in handling second and third surge down the road as we go forward.
Dr. Kyu, would you like to respond? Or Mr. Breen?
You can say first.
Okay.
Mr. Breen, I have a specific question for you because you're a long-time Seoul correspondent for many international news agencies, and you are now a columnist for several Korean newspapers. So do you think Korean media, including KBS World Service here, should change its approach in reporting about cluster infections involving subgroups or minorities in our society?
Yes, but I do. But I hesitate because having been a journalist, I know what it's like on the inside. And when you look at the outside at the media and say, the media should be more responsible, you should try being on the inside and writing stories and writing news. It's a different experience because one of the contradictions about being a journalist is you develop a way of a very objective, neutral type of thinking. You'll listen to anybody. I think young journalists maybe are a bit more opinionated than because of social media than they used to be. But the way that I was taught, you develop this sort of habit. You listen to anybody. You'll sit and listen to a North Korean arguing that the Americans started the Korean War, and you're not sort of disagreeing in your mind. You're actually following down. So you're being very neutral and objective, and you because of that habit of thinking, it's not always easy to anticipate the impact of what you write and how you write. So sometimes there's a lot of criticism levied at media about, their intention is this, or they're doing this. The journalists actually often have no intention. Their intention is to get a story out, and they have to do it quickly. So with that sort of proviso, I would say that from an editorial point of view, I think there needs to be a public service mindedness, which I think Korean media has much more than media I'm British, so I think the Korean media is much more public service oriented than British media. But I do think this one thing I would like to see, and it's historical. It's all around the world. I don't know if it'll ever change, but I think the LGBTQ anymore. Anyway, that issue, I can see that improving. In fact, it's already improved over year by year.
Sure.
But the attitude towards religious groups, unpopular religious groups, is something that I find very puzzling. Why? I mean, I've had people tell me that this place is a cult and they should be closed down and they should be denied all their rights. And so why? Because they're a cult. And it's just emotional religious disagreement, usually coming from Christians. So I'd like to see media take a lead in that and be more respectful.
Sure.
I mean, if there's a religious group doing something illegal, fine. There are laws about that.
We're quickly running out of time already, but I would like to briefly shift our focus from Korea to issues related to international healthcare in dealing with COVID-19. Dr. Jerome Kim and Dr. Ki, what other countries than Korea did well in terms of flattening the curve? What should we learn from them? And also, what are the countries that are failing to properly handle the pandemic? Dr. Jerome Kim.
And I hope that the government is successful. I think that the experience in the United States has shown that the virus will not go away in the summer. If left unattended, it will continue to do what viruses do, which is infect and continue to infect.
Is it going to be worse when the weather becomes cooler?
I think because people will be confined indoors, there's the potential for greater potential for spread. The other part is that there will be a superimposed influenza season. That will make control efforts even more difficult because, again, we won't be able to distinguish as well between the influenza and COVID-19. The nice thing is that actually some countries that have started using masks have reported a significant drop in influenza, which is maybe the one saving grace. The use of masks will also prevent influenza.
Dr. Ki, are you expecting a second wave of massive infections?
That's right. During the flu season in winter, the second wave can come with coronavirus. Also, if we fail to manage the trend that is spreading little by little in these months, this could become a secondary wave. However, if we keep social distancing and wear masks and hand sanitization, maybe we may pass without a second wave.
Dr. Jerome Kim, when do you think a vaccine or a cure will be developed against COVID-19? What kind of timeline do you have?
So the optimistic timeline is 12 months. So maybe by the end of the year, we will have a company, a government reporting that the vaccine is safe and prevents infection. The problem is that, when will we have vaccine? Because it's really not the report of a vaccine or proving a vaccine works. It's actually being able to use the vaccine. So that involves manufacturing and then distribution of the vaccine around the world. And that's actually a tremendous problem. I think Korea is signing on to CEPI, the Coalition for Epidemic Preparedness Innovations, commits the Korean government to a background belief that vaccines should be what I guess President Xi called them, global public good. They should be affordable and accessible to people who need them. That being said, who's going to make the vaccine? And will Korea be like the U.S. government and put down hundreds of millions of dollars to make vaccines even before we know they work, so that we have some available? And I guess that's a big, important question. No. So vaccines don't prevent disease. Vaccination prevents disease. So in order to do vaccination campaigns, you have to be able to manufacture billions of doses. I heard a guy from CEPI talking. They've identified that the global capacity for manufacturing vaccines is 10 billion doses. They've even secured 2 billion glass vials because you need to put the vaccines into something, and there's a global glass shortage now.
Oh, I see.
So, having a person think about the logistics of vaccination, manufacturing, distribution, and use is really going to be key to being able to control this.
Dr. Ki?
Yeah, I think we have to think about the safety before the effectiveness, because the coronavirus vaccine is first time. So we don't know the safety.
Sure, okay. Mr. Breen and Dr. Kim, do you think Korea and other countries are ready to deal with a prolonged pandemic until vaccines or treatments are finally developed and then distributed to the public? And also, for that matter, I'd like to know what kind of new normal are you hoping to see in the second half of the year?
I guess, going beyond the question of vaccine and treatment, I guess, as someone who looks into political economic questions, if there is a strong return of this virus as the season changes, what are we going to do in terms of the economic response to the situation? And so far during the first round, we have seen the progressive government going very, very active in terms of introducing Keynesian measures of very active, what conservatives call redistributional policies of offering, temporary, like a universal basic income style support to the people, everybody. And are we going to continue to do this when there is a huge surge of the cases and the economy kind of comes to a halt or close to halt, like last time we saw this case? How sustainable is this policy going to be? How are we going to deal with overall situation of how we make our living when we have the virus case coming back? I think that's a big question, and I think Korea needs consensus on this so far. I've noted some of the citizens actually like the idea of handing out this free payment. Of course, they're all coming from taxpayers' money, but when we have these
disaster relief subsidies,
relief subsidies coming in the form of some kind of credit card or a check card and stuff, people liked it. And some people are making jokes that, well, we want to have hope to see more of these coming in our way. But they also, again, are very painfully aware that these are all basically their money, coming from taxpayers' money. So I guess while working on vaccine and treatment and so on, I think the society needs to work on creating consensus about how to deal with the situation if it comes back big time in the form of economic and social policy.
What kind of new normal are you hoping to see in the second half, Mr. Breen?
Well, the new normal I'm hoping to see is a lighter version of what we're doing now. And I mean, I've been told by people that it's possible we may never have a vaccine. So I don't, I believe there's no vaccine for SARS, if I'm correct. But I'm hoping there'll be a vaccine and that things will get back to normal. What I'm worried about, though, is, and what I haven't seen kicking in a big way yet, is the economic fallout. And I think there may even be some industries that might take a permanent hit because, once you start, I know in my own family, once you start ordering things online, you get used to it. It doesn't mean once it's all over, we're not just going to go back to what we were doing. There's going to be a lot of people who will stay with the new normal. And so retail outlets are going to be challenged and have to sort of reinvent themselves. Same with vacationing. I mean, we're like a lot of expats, my first thought when I'm thinking of a summer holidays, okay, where are we going to go? Europe, Australia. So, now it's Gyeongju, the East Coast, and so domestic tourism may really benefit from this, but the big carriers may suffer. And again, that may not go back to normal when it's over. And also, I'm very interested. I have two younger children who had spent 3 months at home virtual learning, so I'm very interested in this. This is a future industry, in my opinion, in Korea. Already there are hagwon cramming services that do online teaching, and the teachers are very, very good. And you can actually select your teachers, So I think the schools and the universities are going to be challenged, and we're going to see some sort of improvement in product quality of services in that sense. So that's the sort of thing I expect.
Dr. Jerome Kim, same question. What kind of advice would you suggest to our listeners in this prolonged fight against the pandemic?
So I think until a definitive solution for, in terms of prevention is arrived at, I think that we're going to be living with the kinds of restrictions that we have currently, the routine distancing that the ministry is suggesting, and hopefully we won't have to revert to a higher level of restriction. I mean, eventually the economy will open up again, hopefully in maybe some various new form. And the joke in our house is exactly when my wife says, I think we should go to Hawaii and go to a movie, that we will have gone back to business as usual. And but that has a lot of implications: travel, group settings, enjoying, laughing, talking in tightly closed areas. I mean, it carries a lot of different implications.
In our previous discussions, you talked about how we should think about the protection of others in this prolonged fight. Would you elaborate on those comments?
Yeah, so I think that one of the key elements in Korea, and really the credit goes, I think, to the Korean people and the Korean government for engaging the people so intensely. But one of the elements of Korean society, I think Mr. Breen brought this up too, is their ability to come together in a crisis. So I remember reading about the 1997 crisis, where older women were donating their gold, or Korea's response to the 2008 Great Recession. I mean, the ability of the society to come together really is remarkable. And the older generations, the ones that came through the war and the rebuilding and the economic growth up to the Olympics, and all of this has been remarkable. It's kind of now the turn of the younger people, because the actions that they take, the wearing masks, protecting themselves, reducing their risk, is really protecting their parents, grandparents, and elderly neighbors. And this is the commitment that societies make, I think, and that great societies make to the preservation of life.
Dr. Kim Oran, what kind of advice do you have?
Yeah, I think it will be a new world that lives with viruses, and crisis is sometimes an opportunity, and we must cooperate and unite with each other with a long eye. And I'd like to say that encouragement and support boost your immune system like a vaccine.
Okay.
Yeah.
Well, social unity appears to be the key word we're concluding today. We have to wrap up now. KBS World Radio would like to urge the global community to work together to fight COVID-19 and, as Dr. Kim Oran said, turn this crisis into an opportunity and transform the world into a safer place against new infectious diseases that might come in the future. I would like to thank our panelists and our listeners for joining our special edition Korea24. Please wear a face mask, not just for yourself, but to protect those who are more susceptible to the pandemic. And we hope you stay healthy in this difficult time. Thank you and goodbye.
Thank you.